so now we're going to do blood pressures. One thing that we have that's new this year is we have 3 different cuffs. Last year, yes, you're welcome. Okay, because for obvious reasons, right? So the blood pressure cuff will sometimes alter their blood pressure, right? So if it's too small on someone who has a larger arm circumference, it's going to increase their blood pressure. It's going to act like a, like a little tourniquet. Okay, so they are prettily labeled. Please, when you use these, put them back in the appropriate area. We take time to do this. So I actually didn't even look if they were the right ones. I hope my students don't look like it. Of course not. Okay, this is not the extra large cuff. I will talk to my 367 group after this. This is the normal cuff. So it says adult large. The extra large cuff, I promise you are going to see it's like this much wider. It's substantially wider. So what happens is, can I use your arm? Mm-hmm. What happens is, just kind of mess up here. I don't want to mess up here. Yeah, with the Velcro. You got to get comfortable, right? So they're going to be probably sitting down. Let's pretend like this is real life. They're going to be sitting down, and you're going to be sitting down in a chair with them. Okay. Get comfortable, because if you're comfortable, you're going to get it quicker. If you're awkward about it, it's going to take 2 times as long, and then they're going to be uncomfortable. So you want to support their arm, whether it's your arm or a chair or a table that they're resting on. Okay. This little artery doesn't necessarily have to be aligned with their artery. That actually doesn't make sense at all why it's where it is where it is. Do you want to come over here and film?
Yeah.
Thank you. You're going to get like kudo points for this. See how this fits in the range that it should be in? That means it's the right size cuff. If this was too small for her, what would happen is it would be over here and it'd be in this outside range. You guys all see that? And that's when you know you need to go up. And vice versa, if it's way too big, the Velcro won't be able to touch. And that's when you use the smaller one. There will be a few times when you're going to need to use a different cuff. Okay, so align it. Make sure it's nice and tight so that if the person were to drop their arm, it stays there. Okay, tuck this in, just tricks of the trade. Again, notice the artery is not next to the artery. They make these so that it really doesn't. Because if you want to see it, it needs to be right here. So what we're looking is for the medial side. I know some people say you're looking for the medial side of the arm so we can get that brachial artery. Make sure your stethoscope is turned on. 367 group, we know this. Okay, so when you put it in and you tap it, you should be able to hear it. If you turn it, because that's how some of them are, and you do this and you don't hear it, you just need to turn it 180 degrees. So, heads up, okay? Align it. I'm probably yelling right now. Put it right on a brachial artery. Righty-tighty, so you can pump up. Pump up to, with older adults, I'd suggest about 200. And then slowly release about 2 millimeters of mercury per second. You're ready to hear that very first sound, which is going to be your systolic. And then you continue. As a heads up, sometimes I say it out loud, 120. You let it keep going until you hear the very last beat. 72. Okay, and that's going to be your diastolic. The reason why I suggest, especially students, say it out loud is sometimes when you get nervous, we forget. So if you say it out loud, someone else heard it, and they might be able to help you. Okay? If you say 122/70, the older adult is going to be like, nope, I know my blood pressure so well, that's wrong. Okay, so you got to take it, and you got to know it, and you got to be confident with it. If you don't feel comfortable taking blood pressures, practice before assessments. Group. Okay, we have plenty of blood pressures. So that's BP. So you're going to be doing that with anthropometrics as well as weight, height, and BPs all in one. Okay? Any questions? Okay, good. So let's go ahead and move. You know what? We didn't do bicep curls. I realized. Let's do that. Okay. Do I need to be here? I was checking this out. I was like, that's so nice. You want to curl? Okay. Do you want me to talk through it then? Okay. Okay, so this is going to be your muscular endurance test. This is all part of the functional fitness test. That's kind of why we made the changes this year, so that we have every piece of the functional fitness test. It's also known as the senior fitness test. Okay, so this is a muscular endurance test. The weight of the dumbbell is going to change based on the person's sex. Okay, so for females, it's 5 pounds. For males, it's 8 pounds. I don't necessarily think that's fair, but that's how the protocol is written, so we're gonna follow along with it. It's gonna be their dominant arm, or the arm that they feel strongest in. So this is an example of someone might do it on their right arm, and they might be like, you know what, maybe my left arm's stronger. We have the time, it doesn't take long, it's 30 seconds test, let them do it, okay? So the key here is that, notice that she's sitting up nice and tall, okay, feet are planted. You're gonna have the arm, so it's kind of like a hammer, like bicep hammer curls, okay, but as she comes up, she's actually gonna rotate and supinate, perfect. Theoretically, what you wanna do is you wanna kind of put a finger here and kind of talk to the older adult so it lowers all the way, so they should feel my hand as they lower, and as they come up, they should feel the connection in my fingers. Does that make sense? So it gives them some proprioception that they're doing this movement correct, okay? It's as many as they can in 30 seconds, so you're gonna see people go quickly. What you tend to see wrong is you start to see, you know, when people do bicep curls quickly, they start having some momentum, the arm starts to raise, so that's why it's really important to have these 2 points of contact for them to realize that they need to have. Okay, give them a trial period. They could do it once to see how it feels, once or twice, like a few repetitions. They don't have to do the whole 30 seconds, and then they can try the whole 30 seconds. Okay, any questions? Yeah.
What if 5 pounds is too heavy for some females?
Then they do as many as they can.
Okay.
And if that's one, great. It's a great question. Anything else? Okay, great. Great. Let's move on to
Lower body, 30-second chair stand.
Yeah.
Okay. Perfect. And then the other endurance exercise would just be the 30-second chair standing. So you have them sit on the edge of the chair, and then just getting ready, giving them a couple of trials to test it out, but they want to just plant their feet and stand up, and then lower back down. And then you want to have them do that as many times as they can within 30 seconds.
Hands are crossed over, and they have to stay in contact with the chest. What tends to happen here is this movement. So they want to have like the momentum, you know what I'm saying, of getting up, so they has to be down here the whole time for the 30 seconds. So pay attention to that for this one. Any questions with this one? Yeah.
How far back should they sit into the chair? Like fully seated or just
Yes.
Halfway.
Yeah, exactly how Asia's sitting. Seated?
seated?
Seated? It's Friday. Right now. So long as they can maintain a good posture, because it is a power movement, so they need to be not on the edge, but kind of midway. Yeah. Good question.
For individuals who feel that they can't, just note it.
Yeah. So that goes for, it's a good question. Any single one of these assessments, encourage them to try. If they don't want to, they don't have to, right? It's their body, their choice.
Yeah.